Hi, welcome back to Library Sherry, and today we are finally getting to the microbiology department to talk about why some of the tests are having a extended turnaround time, or what scenario can cause a extended turnaround time. Let's start with the most common cause, that is the short sample. For people who never really worked on a microbiology bench, you probably don't realize how important the sample volume is for us, because eventually you will always get an answer at some point. Well, that's because as long as you have few of the alive bacteria on the sample that you gave us, they will eventually grow out into a usable colony that we can do biochemical tests on it. But the problem with those kind of situation is it takes extra amount of time to incubate it to the size that we actually need for doing all the testing. So one of the things you need to understand is in microbiology test, if you give us a sample that needing for gram stain and culturing, the standard culturing would require 2 to 4 or even 6 plates as a set for culturing it. And some of the plates is just for encouraging everything to grow, and some of the plate is for either supporting specific bacteria to grow or suppress some of those bacteria to grow in order to get a more purified specific strain for doing biochemical testing. So when you give us a short sample, normally it means we'll reserve our testings into the plate or media that support every single possible bacteria strain that will grow it. They are purely nutrient on it. That way we can first get enough of the bacteria and then move down to the next step called isolation. Or we have to probably dilute down your original sample just so we can even get this growing process to start with. Hold on, while I'm editing this video, I think dilute down is really not the best way to describe it. It's more so that we have enough liquid volume to make the gram stain and inoculate all the culture media by adding minimal necessary amount of soil broth into a sample you send us for full workup, but only contains 1 drop of pus in the syringe. We secretly put you on our blacklist when that happens. Just kidding. I can make a very specific example so you can understand this. Let's imagine you have a patient walk into your clinic, and this patient got a red swelling wound. There is some fluid that you can suction into the syringe, but not much. And then you send to us, that's barely 2 drops in there. So what happens now is, typically, if we receive that, we would probably inoculate 3-4 plates and 2 glass slides for gram stain. But since you only send us 2 drops, now what happens is, so first, we're gonna have to ensure the gram stain is done. So you can have your first clue of what kind of antibiotics you should prescribe for your patient just to send them home if their symptoms is not serious enough to be an inpatient. But once the step move on to the inoculation part, we actually have to make a decision on what plates we need to do first. The non-selective plates in microbiology department or media we use are the typical blood agar. That's the one you probably also use in your student lab. That's the red one. And then we have the chocolate plate that is lysed red cells. It has even more nutrient for supporting the bacterial growth. Both of these two has absolutely no selections. Any things we inoculate on this plate, it will grow. And also there is a soil broth. That's also not very selective. It's just supporting anything that you put in there to grow. So those kind of things will be the ones we try to inoculate, and if there's anything left over, we will put it on a McConkey agar that is a transparent, really nice looking pink agar. That thing is a selective one. It supports gram negatives to grow, but will suppress the gram positives. And then there is a CNA plate. It has the same appearance as a blood agar, but it will support the gram positive to grow and suppress the gram negatives on it. That's the most common routine setups for a sample that you send us. So we have couple plates for supporting everything to grow, 1 plate specifically for gram positives, and 1 plate specifically for gram negatives. After a whole day of incubation, you can have enough. First, you can have a lot of colonies for biochemical workups, and also whatever we see under the microscope, positive or negatives. Even if your patient got a mixed bacterial infection, we can still assign very specific high efficiency workflows because we already set up 2 selective plates. But if you send us very short samples, we have no choice but to inoculate primarily on the non-selective plates just so we can have enough colonies to even do anything. And after we have enough things to grow on those non-selective plates, we have to add another extra day to put them on the selective plate to keep on the work process. So in that scenario, you can see there is a whole extra day delay for your result. I do understand sometimes you just can't get more of the samples, but if you do have a choice, or you can do just a little bit squeeze with the patient allowance and tolerance, I do strongly suggest you to send us as much sample as you can, especially if it's a liquid, because that's usually something you can try to get it a little squeeze with the patient allowance or agreement. If it's not fluid, if you are getting us a tissue sample, still the bigger size the better. Don't just like cut a small piece to us and throw the rest of them into a bio waste garbage can. That way we can have enough samples to start our workflow and give you a result as fast as possible. The next thing I need to talk about is the timing you send us the sample. For a microbiology department, the colony readings or the biochemical testings are happening during the business hours shift, like the 9 to 5, that hour range. If your sample colonies is matured after that time range, it will have to wait for another night until the second day morning to be read. Of course, if you have like a legit reason to asking a colony read or biochemical differential testing in middle of the night, you can call us and we can pull people in to do this. But this process is usually would be taking a few hours to be done because night shift coverage for the microbiology bench is not commonly covering the plate reading. We have to pull the techs from the day shift into the lab to do it. You have to wake them up from the bed. So this comes to a question of when will this happen? Most likely is if you send us the sample during the late evening or during the nighttime. When you send us a sample during the late evening and the nighttime, very possibly after less than 10 hours of incubation, the colony is so small, we can't really pick it up to do the biochemical testing and have an accurate reading for you. So now what's happening is we will put it back into our incubator and hopefully reading it on the third day. If we count this by hours, it's probably more of like an 8 to 10 hours delay of compared to you send us the sample during the regular day shift. But for the feeling, it would be felt like a whole extra day of getting a result. One of the tips I can give you for this kind of scenario is if you send us a sample during the early night or late evening and you don't see an ID or biochemical ID result out by the second day in the morning, one of the other things you can do is by 2 or 3 o'clock-ish during the afternoon, give microbiology a call. If your patient is fitting the criteria, like really urgent, or you have really good reason that you definitely need the plates to be read, you can try it again before everybody's gone. 2 or 3 o'clock is most likely many of the hospitals will be doing the last round of plate reading before they go home. So if you give us a call and state your situation, we can't go to the incubator, pull back your plates that you sent late night yesterday, and then try to see if there is bare minimum amount of colonies that we can do workups on. I cannot guarantee you anything, but this is one of the things you can try. And now let's move on to the next one. Next one is the antibiotic treated sample. Because a lot of the patients, when they come in to visit you, especially in the ER, they probably already taking some medication from the urgent care they visited at a different place, or they probably already putting on some ointment that's supposed to be antimicrobial at some level, and then they decide to visit you because they didn't immediately improve their symptoms or redness, swelling, pain, whatever. In that kind of scenarios, the bacteria are not as healthy and happy living at the wound. So when you send it to us, some of the bacteria are halfway dead and they don't hold on to the gram stain very well. That will increase our difficulty to read the slides. Some of the gram positives especially bring difficulties in this scenario because when they can't hold on to the stain, it will be looks like purple and pink, and that will be making us hard to decide if that's a gram positive or gram negative under the microscope. In that case, we will restain the sample and maybe put a disclaimer saying we can't give you quite a definite answer. You have to wait for the plate result. That does happen. It's not super common, but it's also not rare. It happens once in a while. Next one is coming to the nature of different organisms. One of the things that just grow really slow is fungus. A lot of common fungus infections would take a week or two or even a month to having a growth. Ear infection is very commonly caused by fungus that will take many days to grow. And the other very common skin infections would be ringworms. A lot of people have that, and it takes 1 to 3 weeks to having a good growth for the readings. That's a fungus. For bacteria, there's also things growing very slow. Mycobacterium tuberculosis, Helicobacter, the ones causing stomach illness, the H. pylori, that's one of it, and things like Legionella, and pertussis, that's the one causing whooping cough, Haemophilus, and yada yada yada. There are a lot of this kind of bacteria. We call them fastidious bacteria. They just grow very small colony and they grow extremely slow. Speak of this kind of bacteria, there's one thing I need to tell you. If you're suspecting your patient is having one of this type of very fastidious species, for example, if you are a new pediatrician and getting a kid coming in that looks like having whooping cough, one of the things I really suggest you to do is, one, go to search your hospital's test catalog and see if there is a specific test for whooping cough workup. They might be, but if they don't and you have this kind of suspicions, definitely 100% give microbiology a call. The biggest reason I suggest you to do that is because when your patient having whooping cough, the routine workup to get a big enough colony to do following workup would take a week. But if we use charcoal plates from the beginning, we can shorten this length maybe down to 3 days. These kind of plates are specifically designed to supporting this specific bacteria to grow onto it. It's not like most of the bacteria, they grow very happily on blood agar or the chocolate agar, but some of those fastidious ones, like this pertussis ones, they just very picky. They only grow on very specific conditions. So if you have very strong suspicions, definitely give a call and we can try to arrange that. Sometimes if you are at a rural area, your lab is so small, some specialized plates may not be their routine storage. What happens is if you call early, we can either send the specimen to a nearby hospital that do have the supplies to do this kind of specialized incubation, or we can call a nearby hospital to send us the specialized plate. That way the workup can start earlier and you can get a definite diagnosis earlier. Your patient can suffer a lesser time too. So that's a thing. If you have a very specific suspicions or your patient symptoms are matching like textbook level, absolutely give us a call. We'll figure it out. So don't wait until like a week later and then being like, why I don't have a result? Why don't you do this earlier? They might don't have the supply, and at that point they barely might be just got a colony to be able to have some suspicious and then do a workup on it. So chat with the pathologist that is on call or medical director, anybody you can find. And next thing, that's the good news. We typically don't have a delayed workup time, and if we do, that's the time you have a huge worry about it. That is the viral testing. Nowadays, for most of the labs, the traditional viral cell culture is very rarely to be used in a regular hospital. That's the thing you still see in some of those medical dramas, that you use a glass vial to put in cells in there and trying to incubate the virus in there. It's pretty much only exists in the reference lab and place like CDC. That's more of using for public health surveillance and vaccine production or research purposes. For routine lab detections nowadays, we primarily rely on PCR, which is very good because 1 to 2 hours you would get a very definite answer that's detecting the genetic sequence. A match is a match. But when we do have a delay, well, either the sequence is not a 100% match, hopefully you are not getting a new virus is exploding at your area, or your patient might be getting infected by a virus that having such a similar symptoms to you, but is completely not what you are thinking about. So either of these kind of situations, it's gonna be a bad news for you. So for a virus testing, if you don't have a definite result within half of the day, make a call. Of course, first make a call to the bench. Maybe there is some mechanical issues to cause this happens. But once the laboratory bench tell you there's no mechanical issues, there's no QC validation issues, there's no technical issues related to it. It's purely based on you got a weird virus. That's the time you probably want to call the pathologist. But thank goodness, this is super rare, very rare. So let's hope you never get into this kind of situation. This is everything that can cause you to have a delayed resulting time in microbiology department: sample size, test timing, and the nature of the microorganisms. If you're a provider or a nurse, next time when you have a result that's supposed to coming back to you, or you hope that to coming back to you, but for some reason didn't, think about these 3 big questions. Maybe it will fall into one of the categories, and then decide if you really want to call us or what kind of question you would like to ask on the phone. It will for sure increase the efficiency of communications between you and the laboratories. Thank you for watching. This is Lab Rat Sherry. I'll see you in the next episode.